Thank you all for joining today. Super excited to be here. My name is Tia. I am a part of the Physicians Relations team here at Prenuvo. And I've had the pleasure of working closely with Dr. H and Dr. King over the last several months, and we're really excited to now have a formalized partnership in place between Prenuvo and EHE Health. So a big thank you to the both of you for the continued effort and support to get to this point where we are today. Before we get into today's clinical discussion, which is why we have this webinar set up, I just wanted to take a moment to briefly orient you all as to what this partnership looks like from your perspective and for your patients. At a high level, this collaboration is designed to make it easy for you to connect your patients with Prenuvo's whole body MRI screening while ensuring a smooth and well-coordinated patient experience. For your patients, this partnership includes a $400 preferred rate on our comprehensive whole body MRI, bringing the cost of the scan from $24.99 to $20.99. From a workflow standpoint, referrals for your patients will be sent in through the EHE admin team, from my understanding. So either your admin or actually the patients themselves will use an online web form to submit referrals. And the web form is already set up. It's in the hands of you guys at EHE Health. On this web form, they will indicate EHE Health as well as the patient's name and contact information. Once that form is submitted, my scheduling team will reach out to the patient directly within 24 to 48 hours. They will coordinate the booking, apply the preferred rate, and collect full payment. So there's really no additional lift for you guys as the providers here. Again, just want to orient you so you understand what your patients will be experiencing. One important call out, and I really can't emphasize this enough, it is essential that your patients are routed through that web form through EHE Health rather than booking directly online. That is the only way that we can ensure that they receive the preferred rate, that we track them, and that their experience is aligned with the partnership. You might have patients that are sitting in front of you. They don't know if they're ready to book yet. They want to go home and talk about it with their family. They might be traveling, might not be in town. That is totally okay. But again, to just communicate with them the importance of booking through EHE, however you guys communicate with your patients, to go through EHE to book the scan. We're unable to refund that $400 if they book online. It's difficult to track them down. It's all around just a pain in the butt to deal with. So web form is the way to go. With that, I would like to introduce to you both Dr. Raul Nadendla and Dr. Kas Tayebi, two of Prenuvo's Preventative Medicine Physicians. Dr. Tayebi is going to run us through about a 30-minute presentation on all things Prenuvo, kind of more with a clinical focus. Also, if any questions arise, feel free to throw them in the chat. Kind of speaking for all of us here, we like to keep these webinars as interactive as we can for an online webinar. So throw them in the chat. Dr. Tayebi will answer them as we go. And then, of course, we can save any questions for after. And like I mentioned, the webinar is also being recorded. So anything that comes up, you guys can refer back to this and, of course, spread it to anybody else. Take it away. Thank you all. That is it from me.
Okay, very nice to meet you all. Thank you so much for joining for this presentation. I actually live in New York City, so you might be hearing some ambulances in the background. I know one of your clinics is here, so you're probably used to that by now. But I'm one of the internal medicine doctors here at Prenuvo. I'm going to give you a short demonstration presentation about kind of who we are and what we do and why we're excited to have you as partners along with us in this journey. So go ahead and jump in here. Essentially, I think just a little bit about myself. I'm an internal medicine physician, and I trained in Australia, also in Chicago. I've always had sort of a longevity and lifestyle medicine spin to what I've always been interested in. And it's one of the main reasons why I joined Prenuvo about a year ago. And so we think patients today generally just expect more than just access from their doctor's relationship. They want to have like proactive healthcare fueled by unique insights. So our dedicated whole body screening test is just one of those opportunities. We'd like you to consider how Prenuvo scans can function. Honestly, maybe even as a insurance covered scan potentially down the line in the future, but even how it can function right now is sort of a service for patients outside of the traditional healthcare system. So in this presentation, we're going to talk about the premise of whole body MRI. We're going to talk about the unique aspects of a Prenuvo scan and our additional offerings, and then just kind of the patient experience kind of going throughout the scan, and also the provider experience as well when we are doing our consultations. So essentially, the ability to change healthcare from reactive to proactive really starts with the doctor or the provider working with patients to explore all the opportunities available. We know that late diagnosis has led to fear of disease for many folks. And despite many chronic and killer diseases having favorable outcomes if they're caught early, oftentimes they're caught very late. So whole body MRI can help flip the paradigm to earlier diagnosis, less anxious engagement by patients, and I think just far better outcomes generally for patients. So whole body MRI is by no means a brand new concept. Some of you probably remember when whole body CT scans were trying to be introduced in the 90s. But this technology and precision and reporting of the findings has really evolved with whole body MRI and also doesn't have the side effect of radiation and contrast exposure. We're really serving patients in a way that was never really thought possible before now. So since our founding in 2018, our radiologists have worked with hardware manufacturers, software developers. They were finding a process that once took 2 hours in a number of radiologists, but now it just takes about less than 1 hour in a single radiologist to read. So we have a state-of-the-art method. We provide the most rapid means of assessing the whole body without exposing the patient to, like I mentioned, ionizing radiation, heavy metals from IV contrast. And that makes our scan ideally suited as a disease in the screening setting rather than the diagnostic setting. Obviously, you want to reduce any harm to patients in a screening setting as much as possible. And so by partnering with healthcare providers like yourselves, we're able to detect many diseases in their earliest stages, and we can deliver unrivaled amounts of personal health knowledge to you and also to your patients, and just provide much more needed peace of mind for most patients. So we'll go ahead and jump into the next slide here. So these are some somewhat startling statistics. The reality of disease detection is just that current indicators from the CDC show that 1 in 2 people will develop cancer in their lifetime, which has increased a lot. And part of that's due to advanced, people just getting older. But the rates of disease in younger patients is also on the rise. So we know, like right now, the USPSTF guidelines only routinely screen 4 organ systems for patients deemed at risk. So we have like colon cancer, we have prostate cancer, breast, and cervical. Even prostate is somewhat controversial, and not to me, but I think to a lot of the people out there who are deciding what should be covered and what isn't covered. But then lung cancer screening has also just been used only in specific risk groups. And so as of 2022, only 14% of active cancer cases have been detected by those standard screening guidelines, which is something that I was honestly shocked to learn about. So that leaves about 86% of other cancers that are undetected and without routine screening recommendations available to detect them. So that's a sizable chunk of cancers there that are not getting detected by standard screening guidelines. And then another unfortunate statistic there is that just based on current available screening tests, as much as 45% of diagnosed cancer occurs at stages 3 and 4, which have far more dire prognosis than those that are found in stages 1 and 2. So in a single basically in a snapshot, we can use a whole body MRI to assess elusive insidious processes ranging from undiagnosed uterine fibroids, where I just had a case of advancing fatty liver disease. I have cases of that probably every day, and significant IBD, which we can see as well, and oftentimes even early signs of endometriosis, which, as you know, is one of the most difficult diagnoses to actually confirm in a lot of female patients. So these are conditions that can often evade detection for many years before they finally become understood as the root cause of what ails your patient. So at Prenuvo, we can really help identify the comorbid presence of multiple conditions simultaneously with a single non-invasive procedure, instead of having to be referred for a bunch of extra testing, expensive invasive testing, time-consuming testing. That can oftentimes occur more discomfort and sometimes financial hurt for the patient as well than a whole body non-contrast MRI. And so it's not just cancer. I think cancer is probably the main reason most patients are going to sign up to get a Prenuvo scan in some way, shape, or form. Everybody's been touched by cancer in their life, whether personally or somebody who's been diagnosed with cancer. And I think the same is true for all of our patients. So most people think about cancer when they're doing these scans, but there are a lot of other conditions that it could be chronic or even acute that are not typically addressed really appropriately. Either if they're chronic, they're usually not addressed until they're severe or late stage. And then for the acute ones, sometimes they're not picked up. Think about a classic case of an aneurysm. It's not a cancerous diagnosis, but a ruptured aneurysm can be a lethal complication of an acute scenario, of an acute process there. So early screening with a Prenuvo scan can give you as the doctor, essentially your patient's potential roadmap to identify and strategize, potentially reverse disease processes from their earliest and least damaging stages. So really you got to think about it more as a treatment plan, and even almost like a yearly screening that is part of a general annualized physical to try to reduce that risk of something new popping up that could be potentially harmful for the patient. So we always ask, why whole body screening with an MRI? There's different ways to do it. The two main reasons I would say that we really focus more on whole body MRI versus any other modality is number one. For me, I think the most important is no ionizing radiation. You could get an MRI basically every single day of your life. I don't know why you'd want to, but you could, because there's just no radiation there that can cause you any sort of risk. And then we also, as a screening company, as a screening test, we don't want to use exogenous IV contrast just because of the small risk of side effects, allergies, of course. And if there's any further testing that's ever needed for a patient, they might be recommended to go obtain a dedicated MRI of a certain part of the body with IV contrast for better characterization. But as a screening practice, we tend not to prefer IV contrast use. There's some unique aspects of a Prenuvo scan that we can discuss here. So really, the clarity of the imaging has really improved. So and this is a term I used really after starting to work here, was what a voxel was. So we reflect about 1.3 billion voxels. Think of them like 3D MRI pixels from our 1.5 Tesla coil devices. So these are powerful images, along with our FDA-approved AI-powered imaging software that we use, and also an internal AI research team. We're constantly advancing the ability to help detect cancers and hundreds of conditions in their early stages from our team of board-certified, actively credentialed radiologists. At the current time, I believe we have somewhere near 80 to 90 radiologists, 80 plus at least, I know for sure, on staff. So each radiologist has undergone extensive training with us. They've developed this unique MRI subspecialty of whole body evaluation that I think is really going to become a mainstay for primary care in the future. It's going to become part of the annual screening exam, because I think the benefits now are becoming very, very noticeable compared to the potential risks. And so each of the aforementioned factors, it really helps us become the market leader in whole body MRI. So we're right now with the largest practice exclusively focusing on whole body MRI. We've got locations across North America and actually opened up recently in London. We have another site in Australia as well. So becoming more global day by day. We do about 10 to 15 times the scans compared to our nearest competitor and our more comparable academic centers of excellence. So we've really been doing this whole body MRI scanning for over 15 years in clinical settings. So this is making us one of the oldest institutions pioneering this advanced service and technology. This is just a little look at what our clinics look like here. So each of our clinics has been specially designed to maximize the patient experience. It's actually very comfortable. If you haven't had one yet, I would recommend everybody try and get one. You get fancy with scrubs. You can sit down. It's like Zen music playing. It's really comfortable, and the actual experience at the MRI when you're getting it is about as comfortable as it can be. You're still getting an MRI for an hour, but it's still pretty comfortable, and you can watch movies and do things like that. And we have amazing staff on site at all of our offices. Really, just radiological techs. We have amazing patient liaisons. Just everybody there who help us move forward every single day. So it's something that I'm very proud of. Our whole body scan is completed in about an hour, so 45 minutes to an hour. It's designed to feel very comfortable, as I've mentioned. This is kind of what our scanner looks like here. So otherwise, like I mentioned, we can have patients view and listen to personalized content using streaming services. These techniques, through at least what our data is showing, has minimized claustrophobia rates that were initially about 10% to about 1% across each of our locations. Here's a little snapshot of the power of whole body MRI. We combine what's called multiparametric techniques with diffusion-weighted imaging, and that helps us detect cancers and hundreds of conditions in their early stages. So we don't use contrast and radiation like I mentioned, but we can do, if you will, contrast adjacent studies without contrast. So for instance, we will include a non-contrast MRA of the circle of Willis, and those pictures are really fascinating if you get to see them, and as well as an MRCP of the pancreatic and biliary ducts, just as standard sequences that patients can obtain. And we use AI to weave together those images quickly and accurately, so we maintain image integrity, and we also enhance the image procurement time. So this is just another field where we're continuously optimizing with further goals of reducing time in the MRI machine, while we also want to maintain the highest image quality. And both of those are very critical for success, I think. So this is kind of an interesting comment to make about PET scans versus MRIs. Diffusion-weighted imaging in MRI is something that can help us function almost a little bit like a PET scan. You can see the photos here of what a DWI screening at the end of the MRI does in terms of image readout. So we look for areas of high metabolic activity. We also look for areas where essentially diffusion-weighted imaging is showing us a signal. So as patients, their water molecules move throughout the body, any type of harder lesion, like potentially a cancerous lesion, is going to reduce the amount of restriction. We call it restricted diffusion going through those solid neoplasms, and that can help us pick out certain areas of the body that might look suspicious from a solid mass standpoint. So these are also just a few examples of the hundreds of conditions we can screen for across 33 organ systems. So sometimes as early as stage 1 cancers, silent killers like aneurysms, chronic conditions like fatty liver disease, amongst the possible targets that a Prenuvo scan can help you detect and monitor and potentially treat. So this is really helping people get way out in front of their health and stop problems kind of dead in their tracks before they become a much bigger issue down the line. So there's a tremendous potential, I think, to help improve like the day-to-day life and the quality of life, but also the longevity of your patients, just kind of using these health data points that they gather over the years based on what we're able to provide them. I think ultimately, we as a company, our number one thought is always, how can you save lives? That's the first thing that you want to do. And of course, you want to help with, morbidity and quality of life, et cetera. But number one is you want to be able to save lives. We have a lot of internal statistics that we are constantly kind of internally publishing. We have a large study going on in Boston right now to actually generate a large-scale study in the future. But just the verified statistic from our internal data indicates that about 1 in 20 of our patients are presenting kind of pre-diagnostically for screening evaluation, and they'll be found to have, through our scans, a life-saving condition that's discoverable through a simple whole-body MRI. So we can assist a lot of our patients with low and moderate acuity findings and give them insight into their long-term health, chronic risk factors, in many cases, help with reassurance in the absence of high-risk findings. So we want to talk a little bit about data. The Polaris study, I think, at the end of the day, you always want to see what data is out there to substantiate the claims, because the anecdotes are great. We have a lot of amazing anecdotes out there that you can definitely read about. We've definitely saved individuals' lives detecting, stage 1 lung cancers in 35-year-old patients who are active, runners, didn't smoke, didn't do anything unhealthy. Those stories exist, and there's lots of them, but you also want to have hard objective data. So we ran a study called the Polaris study. It's kind of a retrospective review aimed at evaluating the real-world diagnostic outcomes and multi-cancer detection rates of Prenuvo's whole-body MRI. So we started with over 2,600 proactive participants at our Vancouver Center in Canada in 2022. And just by focusing on those who provided 12 to 16-month follow-up data, and that we excluded those who had already active cancer, we narrowed our analysis down to a final study cohort of about 1,000 individuals. Actually makes the math somewhat easy. It was technically 1,011, but for all intents and purposes, about 1,000 individuals. And this final group gave us a robust and kind of well-balanced data set to evaluate, featuring a nearly even split between males and females and a median age, which is about 56, which I really think that 40 to 60, 45 to maybe 60-year-old range is really one of the most important ranges for patients to go and get these types of screening tests as we can detect potentially dangerous findings then as well. So I know we all want to know about the results. So what we observed was generally an overall cancer detection rate of 2.2%. So that represents about 22 confirmed malignancies across various regions of the body, which is really interesting. I mean, when you look at the tissue sampling that was specifically motivated by our diagnostic findings, the cancer detection yield was extremely high, at 51%. So that demonstrates the strong predictive value of our scan. The standout finding is that about 68% of the cancers detected, ranging from the kidney and the thyroid and ovarian cancers, they currently have no recommended standard screening protocols. And so the majority of these, 64%, were thankfully caught early at a localized stage. So as that graph illustrates, detection rates they predictably scaled with age, peaking in the 65 to 79 demographic. But you can also see, if you just look at that graph, that even people who are younger in their 30s and 40s and 50s, they were detecting cancer at non-insignificant rates as well. So I think this is just really fantastic and interesting data that we've been able to publish. And finally, the scan just demonstrated robust reliability in this cohort. We had a remarkably low 1-year false negative rate of just about 0.2%. And so this slide will contextualize a little bit about our findings by benchmarking the Polaris study results against established routine single cancer screening tests. We still want patients always to go get their routine screening tests. We're in no way, shape, or form attempting to replace the standard screening tests that are already established for patients, but this is just a nice way to compare. When we look at the data, the Prenuvo whole body MRI demonstrated overall cancer detection rate, as I mentioned earlier, about 2.2%, which is significantly higher than standard mammography and low-dose CT for lung cancer. So even more compelling would be, for prostate cancer, but even more compelling would be our positive biopsy rate. So we came in at about 51.2%. So that means that when our scans prompt a biopsy and they notice something that looks concerning, they say you should get that followed up, and the patient ultimately gets a biopsy, about half of those biopsies return a positive cancer diagnosis. So that's pretty high precision. It outperforms the positive biopsy rates for both mammograms at 30% and PSAs at 25%. So that highlights the strong clinical utility of the efficiency of our imaging-based multi-cancer detection approach. And so we have to still talk about the things that we do not cover as a Prenuvo scan. So we do provide a lot of invaluable data for patients. We think it's incredibly important to know that there are certain things that we do not screen for. So we don't intend, like I mentioned earlier, to replace standard of care screening tests like mammograms, ultrasounds, diagnostic breast MRI for breast cancer. I oftentimes have patients ask me that. I've heard about radiation from mammograms, and they get our test and they ask me, is this, you didn't see any worrisome findings on my breast MRI? Do I need to go to my mammogram? And the answer is always yes. We don't intend to replace those established screening practices, but we can augment or at least complement those tests. We don't replace colonoscopies. We don't replace low-dose lung CT for lung cancer or dedicated prostate testing for prostate cancer. And then whole body MRI also has certain limitations that we have to be honest about. So there's the ability to evaluate superficial or very small subcutaneous skin lesions are not able to be detected. There's a number of other things where joints might be a little bit less accurate, given like the small ligaments and the meniscus, or maybe the labrum or the rotator cuff. These types of subtle differences might be hard to detect on a whole body MRI. And those are all sort of listed there, as are a number of other conditions. I think a big one to mention is coronary artery disease. So it's not a calcium score. We don't use, it's not a CT. We don't use any contrast. So we are not able to really define plaques in the coronary arteries. And so patients usually ask about that as well. So this is just an example of a couple of limitations. Although we do cover a lot of things, these are a couple of things. So we support, like I mentioned earlier, the USPSTF recommendations for screening. And once again, we want patients to make sure that they get those normal standard recommended tests and not to use us as a replacement. And then we have safety-based precautions as well. So at the end of the day, we want safety and integrity to be above everything else that we do. So the American College of Radiology guidelines is something that we follow when it comes to MRI protocols for patient safety and appropriateness. So MRI safety is fundamentally managed by each of our certified MRI technologists. And we go through kind of an exhaustive checklist to make sure that patients are adequate and safe to enter into the MRI machines. So for patients, and then we have a different approach as well for patients who have active or recently diagnosed cancer, but who still want to pursue a Prenuvo scan. We have created something called sort of a provider-assisted scheduling pathway. So we essentially just want to make sure that a patient does not want us to provide them with a diagnostic test for cancer, when in reality we're a screening company. If that makes sense. So let's go ahead and message. Okay. So we've created a provider-assisted scheduling pathway. So we have a panel that reviews patients who have active cancer or who have recently diagnosed cancer, and we can discuss them sort of a group session there to evaluate if they are eligible for or appropriate for a scan at Prenuvo. We don't want patients to be using us as a replacement for their normal cancer workups as well. So we pride ourselves on being kind of a clinically forward medical group. First and foremost, our services extend to about 1,000 patients per week across all of our clinics. And each patient is going to receive the highest quality customer care, imaging services, expert radiology reporting, and consulting from our team of over 80 board certified physicians and guidance from over 40 state licensed and fully credentialed nurse practitioners and physicians who, that's part of my role, and the other internal medicine and preventative medicine physicians on the team, and all of our nurse practitioners as well, who are incredible. We all perform consultations post-scan with patients and deliver, I think, a great quality of expertise, a fund of knowledge for patients to be able to bounce ideas off of and really get a deeper understanding of what their results mean, rather than just sending a report and kind of making the patients figure that out themselves. Our radiologists have collectively over 600 years of medical training, along with hundreds of years of practice experience and just thousands of hours just reading whole body MRIs. So they're very much trained for that specific indication, which is it's a different sort of style to radiology, if I can say that. So the OncoRad system is something that Prenuvo physicians have helped pioneer. It's the standard reporting tool for whole body MRI. It's called the OncoRad system, and it's for oncologically relevant findings to be reported into the data system. So this system helps our radiologists, preventative medicine consultants, colleagues outside of our practice to interpret and respond to significance of our findings in a structured and reliable manner. These scores can help your patients also rest assured that low-risk scores are truly a reassurance against high-risk fears. So this is something that we're using and definitely improving every single day. This is a nice little snapshot of what our standard sort of MRI report would look like. You can see that our MRI report is structured by organ system. It's color-coded, reflects the OncoRads and clinical significance categorization of all these findings. And I think it provides findings here that make interpretation by the patient much easier to understand. We also provide some key images on each report that correspond with key findings. So these are all expanded even in greater detail on our patient portal as well. So patients can really go in there and they can mess around and take a look at all of their kind of raw images and all of the cool images and the MRAs and the MRCP sequences, and they tend to get a big kick out of it as one. But the second thing is that they actually get a lot of information out of it too. So we think that every patient should have the ability to see and kind of command their own results and images. And that's why I know we're not going to be sending reports over to EHE, but we do oftentimes send reports to provider groups and kind of give them the information about their patients as well. I want to spend a little bit of time talking about the body composition report and the NeuroQuant. This is something that I'm really passionate about, is our body composition report. The MRI is just by far the best imaging modality to really precisely analyze things like visceral fat, subcutaneous fat, muscle volumes, things of that nature, and even where fat is stored in the body. So liver fat, for instance, being a big one. So it's not a typical body scan. This is an FDA-approved tool that uses artificial intelligence to quantify what can't be seen on the surface. So what really is going on here is it measures visceral and subcutaneous fat. It measures liver fat percentage, gives early insights into fatty liver disease long before the lab values change. I can't tell you how many patients, because we also offer blood tests. I've consulted on patients and, their AST and ALT are going to be normal for many years, and they still have a mild to moderate amount of liver fat, which is just smoldering under the surface. And I think the classic old school way of diagnosing sort of non-alcoholic or, metabolic associated fatty liver disease was to go off of the liver enzymes. And we just know now that that's a really late indicator of liver fat. So this is one of those things that I'm very excited about, is being able to identify these trends early and then getting patients to make healthy lifestyle changes, hopefully to reverse those trends. We also measure skeletal muscle mass, so that helps us assess strength, aging, and recovery potential. And then we also quantify organ volume. So livers, kidneys, spleens, gives us little benchmarks for future comparison. I think of this kind of report as a metabolic snapshot. So it shows not just your anatomy, but how it's actually functioning and looking on the inside. And then clinically, I think this information is important to help identify trends like, early insulin resistance, muscle loss, visceral fat accumulation, et cetera. Here's a sample. It showcases a high-level summary from a sample whole body composition report. Basically, you can see here, I know it's kind of hard to read with the sample just splashed all over pasted right over the surface there. But basically what we're looking at, you can see those bars. The total muscle volume, this particular patient is going to be very high in the muscle volume percentiles, which is what we like to see. And then you can see the visceral fat and subcutaneous fat stores are also listed there, kind of decently low. So we'd like to see that generally on our patients. So this is one of these that I would classify generally as a good subcutaneous fat, good muscle volume, but then the visceral fat stores are very high. And this is a type of patient where you might be asking the question, why is there such a discrepancy in this patient's report? Why is there such a high visceral fat percentile compared to the subcutaneous fat? And then you kind of get into the weeds and kind of try to figure out why. I'll tell you, one of the things that I've seen is patients who ever have fat removing surgery, liposuction, thing of that nature, they'll have these types of profiles sometimes, but that's not the only cause. So this is another photo here from the whole body MRI. This is our T1 whole body MRI series that just shows in the body composition at the end of it what your body looked like under the MRI from anterior to posterior. We're able to see basically all of the organs there. You can see the white stuff that's around there, around the almost here in the visceral fat compartments. You can see that the subcutaneous fat compartments here are nice and healthy. And then you can see the muscles as well in this area. So I want to talk a little bit about NeuroQuant as well. I think if the body composition is telling us what's happening below the neck, the NeuroQuant is going to tell us what's happening inside the brain. So the NeuroQuant is FDA-cleared neuroimaging tool that we use. It's FDA-cleared, like I mentioned, it's AI run, and it measures brain volumes, essentially. So in simple terms, the NeuroQuant converts a standard brain MRI into a quantitative map that measures over 40 different brain regions, including the hippocampus, the ventricles, the cortical areas. And instead of just looking at the brain and saying, like, these just look like normal volumes for age, the AI can actually compare each patient's brain volume to thousands of age and gender match cases in a massive normative database. So this means we can actually see when someone's trending outside of the expected range for certain different areas of the brain, and often years before symptoms appear. So this is one of those things I'm also very excited about. I think neurodegenerative disease in general is one of those subjects that has fallen to the wayside over the past few years. And I think now with the advent of better AI tools, of better imaging tools, we're actually starting to predict things like Alzheimer's and dementia with higher degree of certainty and get patients the care that they need to try to prevent those from happening in the future. So it's a really cool piece of technology. And I'll go ahead and show you a sample here. So this is the overview of the NeuroQuant report. So once again, FDA-cleared AI-powered software provides a detailed quantitative assessment of various brain structures. The report breaks down automated volumetric analysis into specific functional areas. So like we have the lobar cortical structures, the big ones. We have the hemispheric asymmetries. We have memory-related regions and white matter integrity regions as well. They help compare the patient's brain volumes against that normative reference databases that help support the early detection of neurological conditions. So I can certainly go into more detail about the NeuroQuant at the end. In the interest of time, I don't want to go through an entire case. I think that might take a bit of time, but I'll show you another slide here. So this slide takes a closer look at the section that I think most patients care the most about, which is going to be the memory-related structures in the brain. And the data table breaks down measurements for the key brain regions. So in this particular patient, you might notice that the posterior cingulate cortex, one of the memory regions there, is under the 5th percentile for that normative percentile. And then the superior lateral ventricle, which normally the ventricles should be small, is pretty enormous there, 99th percentile. So this is one of those cases where you can also notice that the hippocampus and the hippocampal occupancy, both indicators possibly of a risk for dementia down the line, is that if their percentiles seem to be very small, this patient could have an elevated risk for developing dementia at some point in the next 5-10 years. And it's hard to know that without speaking to the patient, obviously getting a nice family history and then just discussing what these numbers can mean. Oftentimes, these types of findings, if patients have any concerns about cognitive decline or issues with memory, they should be assessed clinically by considering cognitive clinical testing, patient history gathering, family history, cognitive blood panel testing, and possibly more. But this is a great way for us to give patients insight into their brain health many years possibly before some sort of neurological degenerative disease could take hold. So as we wrap up, I just wanted to kind of give a big picture, summary of kind of what we're doing to help providers and also just helping patients. So time, and I think that time allocation in the clinical world is one of the harshest realities of current healthcare practice. So I think one of the greatest benefits of using Prenuvo is the ability to reallocate your time away from diagnosis and clinical management and back kind of into health prevention and health optimization. So these are some charts here that show the time to diagnosis for certain different models of care with a Prenuvo enhanced versus a reactive model that we've created as well. And then some common patient needs post Prenuvo scans. Patients generally, they see that a lot of doors can be opened quickly, and they love unlocking the full potential of healthcare strategies for themselves and for their loved ones. So sometimes patients will be recommended by their primary care doctors then to go to a specialist consultation for specific irregular findings. They might get a more thorough primary care management of various factors that can be influenced by lifestyle modification, medical interventions, simply surveillance, as well as direct preference for follow-up diagnostics that would otherwise be hampered by, as we all know, insurance and scheduling roadblocks. So I think last but not least, the results of the whole body MRI can lead to accessing potential treatments as a proactive approach to enhancing, long-term health instead of relying on the reactive model approach that we've had for so long of managing long-term illness. And so with that, I will say thank you and open the floor for questions.
Thanks, Kas. I'll just introduce myself since I missed the beginning. I apologize. My name is Rahul Nadenla. I am the Director of Clinical Business Development here at Prenuvo. Essentially, I help integrate our business operations with our clinical operations. My background is an emergency medicine physician here in Washington, D.C., where I still do a few shifts a month. There was a few questions in the chat, one regarding our locations, and then one regarding adverse events, which, as I noted in the chat, were not measured as part of the Polaris study, but we're actively investigating currently at our Hercules study at our Boston site, which is purely devoted to research. And so that's looking at patient outcomes over a much longer period of time compared to our Polaris study, and then also a much greater patient volume. So hopefully we'll be able to publish in kind of an interim study report for that once we kind of get that barometer as well. But feel free to ask any other questions in the chat. We can address them. If you have more, specifically patient-sensitive questions that you don't want to put in the chat, you can always reach out to directly, and then she can direct that to Dr. Tayebi and myself as well. So it looks like there's a question from Jamie in the chat. At what point, if any, does care need to be transferred to a provider outside of Prenuvo? So I'll go ahead and start, and then Kas, if you want to add on anything as well. So that's a good question. So when a patient gets a scan with us, they obviously get the report of the findings, which Kas showed that kind of example. Every patient that scans with us also has the ability to schedule a consult with us, involving one of our NPs or one of our physicians to basically review the report, review all the findings, ask any questions that they have directly to a Prenuvo provider regarding the whole body MRI or regarding their findings that the radiologist saw. If there are any findings that need follow-up, whether that is, in 1 year, 2 years, a reassessment of a specific finding, or if it's something that needs to be a little bit more time sensitive, like a dedicated diagnostic imaging for a finding, for example, in the pancreas, a radiologist may directly recommend an MRI abdomen or MRI pancreas with contrast to further clarify a lesion. That'll be clearly delineated in the report in terms of the follow-up recommendations. And then in the consult, our provider will review that with the patient as well. We do not directly refer patients out to any specialists or any specific team. We have a variety of physicians and health systems we work with, and we can give patients options if they need them. But we don't directly refer out ourselves. And so we always welcome the patients to follow up with their primary care physician and the primary care team as well.
Yeah, and if I could add to that, did you, in the emergency setting, I'm not sure if you mentioned that part, Raul.
Yeah, definitely. So if there's any, that's a good point.
I can talk about that. I just wanted to make sure you didn't cover it.
Yeah.
But yeah, so basically, essentially, if somebody has a finding, let's say day of the scan, something is flagged as being potential emergency. So, for example, an obvious pancreatic mass that is enormous, and it looks like there possibly is some sort of a metastasis throughout the body. The patient is asymptomatic, doesn't know about it. These are things that we don't wait, to inform the patient about. We will call them same day. We will advise them to generally go to the emergency room if that's necessary in that particular case, and kind of go from there. So we do escalate things when we see things that do not have the luxury of waiting, a few days or weeks.
Yeah. For example, just following up on that specific, we had a recent patient in the past few weeks that had a large brain aneurysm. So large to the fact that our radiology and preventive medicine team that Kas is a part of recommended that patient go directly to the emergency department. The patient was ultimately admitted to the hospital and had a procedure intervention done that same day. And so, those are the findings where even if it's not something that's, suspicious for cancer, which obviously Prenuvo is known for, those are the other kind of screening conditions that we assess. And then if there is an immediate finding, we make sure to contact the patient and their referring provider. So that way, those things are not missed at all. There was another question about incidentalomas. How frequent is that a problem? So that's another good, question, good clarifying point. I would say we don't necessarily really see it as incidentalomas. I mean, the idea behind whole body screening is that you catch things that may be suspicious for something down the line, even if they're not immediately now, and really can serve as kind of a baseline of health. For example, I personally see Prenuvo and kind of this whole sphere of whole body MRI screening. The benefit is longitudinal tracking. So even lesions or nodules that the radiologists call likely benign, don't need any follow-up. Today, if they do see any kind of significant change in a repeat imaging in a year or 2 years from now, for example, then they can either further clarify that, yes, it's, still the same size, making even more certainty that it's benign, doesn't need any follow-up, or, it's actually changing in size, changing in morphologic characteristics, much different than we expected. And now we can clarify, okay, this actually needs dedicated follow-up imaging. And so our radiologist is going off on the Oncorad scoring system 1 through 5 and the clinically significant diagnosis scoring system 1 through 5 that Kas described, really gives those recommendations as the next steps to both the patient and the referring provider. So that way they're not chasing every finding, only the ones that are actually necessary need follow-up.
Yeah, I think definitely a great explanation. And one thing I would add to that is the quality of the MRIs and the reads just over time have gotten so much better when it comes to actually characterizing what these lesions are. I think I mentioned the history of CT scans being used in the past for, whole body scanning, and oftentimes they just didn't know what they were seeing, and so they would have patients go and get a bunch of unnecessary testing and potentially harmful testing, and of course they were dosing everybody with a bunch of radiation, so none of that was good. The technology now, the vast majority of our findings generally during a screening MRI are benign. I guess you can call them incidental, but we don't call them that because we're essentially screening for everything. And so I would say that's another distinction to make too, is that just the quality of the reads and the quality of the imaging has gotten so good that we can actually characterize almost all the findings that we see pretty quickly.
Another question is, how do you handle patients that are not referred by a provider, simply want the test? In the case of EHE Health, our providers are not referring. I think Tia can add on probably a little bit more to this specifically in terms of the workflow, but we often get patients, one, that are referred by providers, but two, that are not referred by providers and are interested. in Prenuvo scans. And so that is, perfectly fine. In this case, where the patients are not referred by provider, really only the difference is that we give the report only to the patient. And then if there is a provider that they want to send us to, we just have a release of health information form that the patient fills out, and we send those, the Prenuvo report and or the MRI images themselves if it's needed, to whichever physician or medical system that the patient needs.
Yeah, I'll jump in here as well. And just to give you all some context, a majority of the revenue at Prenuvo as a company is through the direct to consumer line, meaning folks are just going online and booking a scan. They're not actually being referred by a provider. So that is the normal workflow. And then I specifically am on our provider relations team, and we have set up partnerships depending on what you guys want as a clinic. Every partnership looks different. So we have it set up for EHE Health. Dr. King, I know that we have worked explicitly to, figure out what works best for your workflow. But just so you guys know, that is how a majority of scans work, is not through a referring provider.
Yeah, just going off that, we have like three main channels. One is Tia noted, direct to consumer, where patients are coming directly through us without a referring provider. Two is a provider partnerships channel, which is basically any patient that is referred by a provider. Obviously, most of those are primary care. And then three, what we call our enterprise. We work with a lot of fire departments, a lot of unions, some veterans groups as well, especially because some of those groups have higher incidences of cancer or other diseases just due to their work. And then there's another question, is the consult after the results received an additional cost? So the consult is built in to the price, so that's automatically included with the scan. Obviously, we want to not only give patients a good experience and a good report, but we want to make sure that they know what to do with the findings and those next steps that the radiologist recommends. And that's really where the consult comes into play. And honestly, I think personally, I think that's one of our best features. Kas is one of the physicians that do those consults, and we get great feedback from our physicians and our NPs that do those consults because they have been specifically trained on whole body MRI and how to review those images and how to review that report with the patient and address any questions with that. And then, is there an age limit for the scan? No limit in terms of, I've seen patients, maybe, Kas, what's the oldest patient you've seen scanned?
Cincinnati.
I have to say, I think
he was sharper than.
I have to say, I think the oldest I've seen on a scan is 102. But correct, Jason, as notes there, our minimum age is 18. We do not scan any pediatric patients. All right, I'll let Tia have the last words. But obviously, as I said before, if you guys have any follow-up questions that are not addressed here, or we ran out of time for, feel free to email Tia and she can bring them up to Dr. Tayebi or myself. But appreciate you guys taking out the time to come and listen to us today.
Yeah, thank you.